But if I were to come see you with a patient and I was running a fever and had night sweats and so forth, how is it different in 1990 and 15 years later in 2000, or 25 years later in 2025? Your approach?
First off, if a patient does have a fever, then they are sick, but it doesn't mean that they have a bacterial infection. They could have a viral infection, and most likely they do have a viral infection, like the flu or COVID. And at that point, you can take antiviral drugs if you want. The only indication really for antibiotics is if you have a culture and you swab somebody's tonsils and they have strep, you got to treat them, as opposed to the typical standard of care, which is oral antibiotics for 10 days, which destroys bowel ecology. And now, Doug and I were both reading an article in Medscape this morning talking about the increasing incidence of cancers in young people, and they were talking about the importance of the microbiome, and that's really great that they were able to clue into that.
They're finally getting there, but 20 years ago, you and I talked about that.
Yeah, exactly.
How did you know God put the bacteria and the milieu, the yeast and so forth, the terrain, and we just need to restore it after an antibiotic?
100%.